For a long time, it's been the prevailing wisdom that an ounce of prevention is worth a pound of cure. Recognizing the validity of this adage, insurance companies often charge less for group coverage if the plans include contraception. After all, condoms, the pill, and other methods of preventing pregnancy are far less expensive than OBGYN and prenatal visits, not to mention the cost of delivery or, in some cases, neonatal care. With this in mind, President Obama's healthcare initiative included a directive that employers offer access to contraception in the mandated coverage they provided for the employees. This raised the hackles of the Catholic Church, which opposes contraception, believing that sex should be for purposes of procreation only. Leaving aside for now the blatant stupidity of that position, this caused a bit of a political backlash for the president. Never mind that the plan is basically a part of the employee's salary, and the employee should have the right to spend his or her salary as he or she sees fit. Never mind that the Catholic employer gives monetary payment to the employee, which the employee has always been free to spend on condoms, IUDs, or anything else. Porn, a mistress, prostitutes, tithing the Pentecostal church, funding the IRA, buying Richard Dawkins books, etc. The thought that the free will of their employees might be tempted to access their legal right to prophylactics as part of a plan that was actually costing the church less money because the option was included was somehow interpreted as an attack on the sovereignty of the church, which has been largely responsible for the AIDS epidemic in Africa because of their myopic position. Seriously, it's as if the Christian Scientists were objecting to the insurance they were mandated to pay employees if it offers medicine. Proposing an end run around the problem, the president simply refocused the wording of the mandate so the insurance providers are the ones technically offering the opt-in service, and not the employers, which would include such agencies as Catholic universities, hospitals, and printing presses.
If a woman's employer is a charity or a hospital that has a religious objection to providing contraceptive services as part of their health plan, the insurance company, not the hospital, not the charity, will be required to reach out and offer the woman contraceptive care free of charge.
The employees now must ask the insurance providers for the service, which is no longer automatically included in the group plan offered by and partially paid for by the Catholic employer. But does this placate the church? No, far from it.
This is the most serious infringement on this by the federal government on the rights of Catholics and others in 200 years. He doesn't even have the woman paying out of her own pocket in the insurance. He wants me to pay for it. For the they really want us to pay for abortions. That's where this is going.
So what's a president to do? I have a suggestion. President Obama should once again change the wording of the mandate so that the insurance companies still must provide the coverage upon request. However, since the church-run businesses have opted out, they should not be legally even able to benefit from the associated cost reduction. In other words, charge the church groups as if the coverage wasn't available and the risk to the insurance companies was equal to there being no preventive availability. Everybody wins this way. The insurance companies make more money and can pass the savings on to the rest of us. The employees still have access to a perfectly legal service, and the church isn't being forced into the role of hypocritical beneficiary of a propitious service which they oppose. Wins all around. Thank you.